Hi everyone, today I will be presenting our work on CNN-aided factor graphs with estimated mutual information estimation features for seizure detection. Epilepsy is a chronic neurological disorder which affects about 50 million people in the world. This disease is usually associated by recurrent episodes of abnormal brain activity in the central nervous system known as epileptic seizure. These seizures can have different side effects on patients' bodies, such as muscle contraction and loss of consciousness, that can make patients' daily life really challenging. So, as a result of this issue, early detection of epileptic seizure can notably improve patients' quality of life. The most common tool used to diagnose seizures is EEG signals. EEG recordings shows both interchannel correlation as well as temporal correlation. Interchannel correlation results from the fact that when seizure happens, it propagates to the other regions in the brain. So the purpose of this study is to develop an algorithm in order to exploit both spatial and temporal correlation among EEG signals. And this algorithm is based on designing a hybrid model-based and data-driven approach. So this algorithm consists of two main elements, using a neural mutual information estimator to capture the interchannel correlation, and using a learned factor graphs to capture the temporal correlation. In order to implement our mutual information-based CNN-aided learned factor graphs, or MICAL, we first selected the EEG recordings from a public database called CHP-MIT. After that, we used a rolling window of 32 seconds to segment the EEG signals for the input of our mutual information estimator, and also rolling window of 4 seconds for the input of the design 1D CNN architecture. Our mutual information estimator can quantify the instantaneous dependence between EEG channels, and the 1D CNN generates the latent representation of raw EEG blocks. We then applied the factor graph to our joint features from mutual information estimator and 1D CNN to exploit temporal correlation. So the advantage of using factor graph is that through hidden Markov model and some product of messages based on some product algorithm can exploit temporal correlation at reduced complexity. If you look at the results section at the left bottom side of this section, you can see two heat maps. So these two heat maps shows the mutual information estimation output for one patient for no seizure and seizure state. So first, we only showed the upper part of the matrix because mutual information estimation is a symmetric parameter. And also, every pixel in this heat map shows the mutual information between each two pair of channels. So obviously, the brighter the pixel, the higher the mutual information and also correlation. So if you look at the heat maps, when we are moving from no seizure to seizure state, we can see the mutual information estimation is getting increased. So it implies that our estimator is strong enough to capture high correlation during seizure. In order to evaluate the performance of our algorithm, we measure three performance parameters. So and also we consider 5 different models for the comparison, 2 baseline state-of-the-art models, as well as adding the GRU to our proposed 1D CNN in order to have another model that can capture temporal correlation. And to have generalizability, we use 6-fold leap for patients out evaluation. As you can see in the results section, our MICAL algorithm shows the best performance compared to other 4 models. So this implies that our factor graph is strong enough to capture the temporal correlation, and our mutual information estimator, it can make our model really accurate. So in our our proposed model is based on data-driven, is a hybrid model based on data-driven and EEG-based seizure detection to exploit interchannel and temporal correlation. our mutual estimator can capture high nonlinear correlation between EEG signals during seizure, and our combined feature from both MI estimator and 1D CNN with factor graph can result in exploiting temporal correlation at reduced complexity. And as I mentioned in the results section, Michael was generalizable for all patients, as well as shows the best performance compared to the state of the art. Thank you all for listening to my presentation, and I'm happy to take any questions.
Dr. Gorbet, if you have any questions, go ahead.
Hi, thank you for the nice presentation. I may have missed that in your presentation or in the poster, but to me it seems like you're using a database currently to train your model and make sure that it can detect properly. But I was trying to understand, you know, what's the end goal? Because I'm assuming you want to eventually like use data that is being I guess collected. Is that the goal? Like what are you trying to do with this data and the model in general?
So in this model, ultimately we're trying to detect the seizure, like the time interval that seizure happens. So right now we are only using this data set that has only 24 patients. But in the future, we are planning to include more patients from TUH dataset from Temple University. It has around 10,000 patients in order to make sure that this model is really generalizable to kind of sell it or apply it in like clinical application.
And can you tell me, because this is where to me I'm missing a little bit the link, is that identifying time of seizure and between seizure is important for what eventually how is it going to help, you know, the patient that is undergoing those, or the drug company having this better model available? So
like first of all, this model can be used in real-time application, meaning that it can use, so it can use maybe even before, it can like warn the neurologist before seizure happens. So it can say that seizure might happen in this time interval. So they can have like prediction. It's kind of
all right. Yeah. But can that data also be used if you're trying to better assess, you know, the timing interval and you've got a better model? Can that be used by, like, where is it used eventually?
Right now there are some software packages in the clinical applications that they are like using for that purpose, but based on recent study, the detection rate for those software is very lower than our results. So that's why we are aiming to include more patients to make sure that this is really good for that purpose.
Okay, thanks.
No worries.
Dr. Gutierrez?
Yeah, so I'm thinking about the application for this algorithm that you developed. But before that, I would like to know a little bit about the Michael that you mentioned. Can you explain a little bit on that one? Maybe I missed the point.
Sure. So it's Michael is, you mean, are you talking about mutual information estimator?
Yep.
So this is based on basically, so for mutual information estimation, one equation is KL divergence, but KL divergence is hard to like apply it in real time. So to calculate it, so we use this work was already done by another people. So they call the approach SMILE. So where they define a lower band for KL divergence, and based on neural network, they try to train that lower band to find, and that lower band is based on T function. There is an equation for that. So they try to find some T functions, subset of T functions that satisfy that inequality to find the mutual information.
Dr. Bai, do you have any questions?
No, I passed this one. Thank you.
All right. Thank you, Bahareh.
Thank you.